Today, Judge Bachman has affirmed our position that Johnson & Johnson, motivated by greed and avarice, is responsible for the opioid epidemic in our state. Johnson & Johnson will finally be held accountable for thousands of deaths and addiction caused by their activities. Throughout the trial, our team proved what we have alleged all along, that the company used pseudoscience and misleading information that downplayed the risks of opioids, leading to the worst man-made public nuisance our state and this country has ever seen, the opioid crisis. As a result, when opioid sales in Oklahoma began to skyrocket, the death toll from unintentional prescription drug-related overdoses mounted, leaving in its wake broken homes, families, and communities. We showed how the company repeatedly ignored warnings by the federal government and its own scientific advisors about the dangers of its drugs and the risks of marketing its products in the way it did. The company promoted its products through unbranded campaigns by funding front groups and many patient groups meant to look like grassroots organizations that spread the company's misinformation. We have proven that Johnson & Johnson built its billion-dollar brand out of greed and on the backs of pain and suffering of innocent people. Although we showed the way Johnson & Johnson created the epidemic, we also showed the brilliant work of those in the state who've been serving on the front lines. These are individuals at agencies like the Department of Mental Health and Substance Abuse Services, led by Commissioner Terry White, Tom Bates and his team at the Department of Health, and at the OSU Center for Wellness and Recovery, led by Drs. Casey Schrum, Jason Beeman, and Julie Croft. These people I just named and the countless others who I didn't are heroes. It is safe to say that without them, there would be thousands more dead, and even more would still be in the clutches of addiction. Well, Robert Browning once said, a man's reach should exceed his grasp, or what's a heaven for? So we took the position that given all the scientific review, all the expert consultation that we did with folks like Terry and her team, with addiction scientists in the state and around the country, that given the potential for folks to relapse and given the extent of the epidemic, dealing with it comprehensively was something that we felt was the most responsible way to address this. So we gave the judge a 20-year plan, a 30-year plan. Again, that was designed to ensure that we were dealing with everything that this defendant caused. So what we have is cumulatively from the other defendants in this case, we've been able to put together almost $1 billion to help people in the state deal with the consequences of their actions. And we're very proud to be where we are today. The judge's order, as we've reviewed it, is very clear with respect to the actions of the defendant and its culpability with regard to the epidemic in the state. Question over here, then here. Question over here.
Could you explain, so it's for what, you were asking for $17 billion. This was $572 million. The judge said 1 year. Do you go back to the judge and ask for more, or to the legislature, as the judge said this is that should be addressed by the legislature?
Well, it's a 40-plus page opinion. We have speed readers on our team, but they don't read that fast. So we're going to spend some time looking at the opinion. I've already started meetings with leadership of the legislature and the governor. So there's going to be a united front with regard to how we proceed with this. It's going to be an important step forward in dealing with the epidemic. You know, certainly we would have liked to walk out of here with $17.5 billion, $17 billion and change. But realistically, we've been able, again, to put together almost $1 billion to help Oklahoma work its way through.
Other states are watching this case because they have pending litigation against these pharmaceutical companies. In your mind, is this a day of reckoning for pharmaceutical companies?
Yes, absolutely.
There's no question about it. And the record that's now available to my colleagues in other states is certainly something that's going to assist this process around the country. There is no question in my mind that we had to bring this case, that it had to be tried, that these facts had to see sunlight. That's been accomplished here. And at the end of the day, you can't sit in a corporate suite somewhere for the last 20 years and oversupply the country. 10 times more of this drug was coming in, and then you had concomitantly 15 times more people dying from opioid overdoses. So there's no question in my mind that these companies knew what was going on at the highest level. They just couldn't quit making money from it, and that's why they're responsible.
Pretty hard question to answer. I'll try. I feel like my boy's looking down, and it's pretty tough deal. But I think my son and Austin are celebrating today, and we got to get help to these other kids. So I'm very grateful for the court for what he did, and depends on what these other companies do now. Am I optimistic? No, I'm not. I think they'll appeal this thing and fight till hell freezes over. But my boy and Austin are fighters, and we are too.
What's your message to other families? You and your wife and the Boxes were very brave to talk about opioid and opioid addiction when so many people were not talking about it. I mean, you said to me that no one was talking about it at the time. The Boxes felt really similar.
No.
What's your message to families out there that have loved ones dealing with this tonight?
It's hard because you love your kids, and you're looking at the worst thing they ever did in their whole life. And that's all people judge them by. Austin was a good boy. My son was a good boy. They got sick, and we didn't know what to do. I know what caused it now, and I plan on fighting it in some form or fashion the rest of my life. But anyway, I'm still here, and I'm gonna keep fighting.
Thank you.
Thank you.